Cholesterol embolization after transcatheter aortic valve replacement. Definition. Transcatheter aortic valve replacement is a minimally invasive procedure that replaces a narrow aortic valve that cannot be opened properly.
This is Dr. Edisham, who is going to obtain vascular access prior to a cerebral angiography on a patient with an AVM. Okay, so we'll be demonstrating vascular access technique using a standard micropuncture kit. We have a patient positioned with his right femoral site prepped using standard technique. These are the components of our micropuncture kit. We have a micropuncture needle that is sheathed. We have a micro wire. We have a 5 French dilator. We have a J wire. We have a 6 French sheath. So the first step is we palpate the inguinal ligament, which courses from the end.
Application and nursing. New models of valvular endoprothesis are under clinical evaluation. The aim is to incorporate characteristics to reduce the diameter of the chest. Pros and cons. Pros. Transcatheter aortic valve replacement might relieve the signs and symptoms of aortic valve stenosis and might improve survival in people who cannot undergo surgery or who are at risk of severe complications.
This is an animation showing transcatheter aortic valve replacement through the transfemoral approach using the Edwards SAPIEN 3 transcatheter heart valve. The heart's main function is to pump blood to the rest of your body. The heart contains 4 valves. Normal valves have 2 or 3 flaps of tissue called leaflets that open and close like gates to control the flow of blood through your heart. It's important to know that if you have aortic stenosis, your aortic valve narrows due to calcium buildup. This prevents the valve from fully opening, which blocks blood flow from your heart to the rest of the body. As a result of the reduced blood flow, the body does not get the oxygen it needs, which can lead to symptoms. Aortic stenosis is a progressive disease, which means it gets worse over time. It's typically measured as mild, moderate, or severe. The only effective treatment for severe aortic stenosis is to have your aortic valve replaced. Today there are 2 options for replacement: open heart surgery or less invasive During the TAVR procedure, you may be placed under anesthesia. Once under anesthesia, a small incision will be made in your leg, where your doctor will insert a short hollow tube called a sheath into your femoral artery. Sometimes, as a first step during the TAVR procedure, balloon aortic valvuloplasty, also known as BAV, is performed in order to open your narrowed calcified valve. Once the sheath is in place, your doctor will guide a catheter with the balloon on the end of it up to your aortic valve. Once the balloon catheter reaches your aortic valve, the balloon is inflated to open your narrowed calcified valve. The balloon catheter is then deflated and pulled back from the aortic valve. During the next step, your new transcatheter heart valve is crimped onto a delivery catheter, which makes the valve small enough to fit through a sheath, so it can be delivered to your heart. Using a special type of X-ray, your doctor will guide the delivery catheter carrying the new valve through the sheath and up to your aortic valve. The balloon of the delivery catheter is inflated with fluid, expanding the new valve within your diseased valve, pushing the old leaflets aside. The balloon is then deflated and the delivery catheter is removed, leaving your new heart valve in place.
Used applied in Ecuador. In Ecuador, new studies are being carried out in an attempt to extend the indication of TAVI to lower risk and younger patients.
The transcatheter aortic valve replacement procedure is performed on patients who have severe calcified aortic stenosis. And here you see an aortic valve that's not opening well. It's severely calcified and the leaflet motion is restricted. So to perform the TAVR or transcatheter procedure, a wire is inserted in the femoral artery. It is threaded up through the aorta and
Conclusion. To optimize the result of the treatment is essential and exact selection of the patient.
Vascular Institute takes you inside the heart for a transcatheter aortic valve replacement, or TAVR, at Unity Point Health, Cedar Rapids. TAVR is a minimally invasive cath-based procedure to replace the aortic valve in a patient with severe aortic stenosis. It's for individuals that are high risk or too sick for open heart surgery.
Trials. So for patients who are elderly, who are frail, and again we calculate the score that tells us what is the chance that this patient is going to have a major complication from a classical open heart surgery, and it's the